We're going to bring in our chief health editor, Dr. Partha Nandi, this Friday. And Dr. Nandi, any indication this new variant is overtaking Delta?
So, Glenn, at the moment, it looks like Omicron could edge out Delta. Now, why do I say that? Well, we just need to look at what's happening in the United Kingdom. Health officials there, Glenn, say that the Omicron cases are doubling every 2 to 3 days. That's incredible to me. And if the growth rate continues at the pace in just 4 weeks' time, right, 50% of the virus cases will be caused by Omicron. The trajectory of this variant is so steep right now, right? The trajectory is so steep that the United Kingdom is forewarning that 1 million residents could be infected by the end of December. Now, I know that sounds alarming, especially since Michigan has its first Omicron case, and this new variant has been found at least 23 other states. But only time and more data will tell if Omicron will outcompete Delta, and the quick growth rate we're seeing in the UK certainly indicates that it's possible.
So, Doc, what's the latest data saying about Omicron and the severity of the disease?
So, Linda, the World Health Organization is stressing that, again, it's too soon to draw any conclusions, right? We need to look at the data. But if we're looking at the preliminary evidence that suggests that the Omicron is causing milder illness, to me, that's good news. Now, a lot of data is coming from South African scientists, and the population there, as you know, tends to be younger, which we all know that younger people tend to do better overall when infected. Having said that, hospital admissions are starting to rise in South Africa. And I think this is because the sheer number of folks that are getting infected, and not because the new variant is leading to more severe illness. Again, I want to stress more data is needed. We're data driven here, especially from the US. Now, a lot of people are concerned about hospitals here filling up in Michigan. We talked about this earlier, and rightly so. Plenty of my patients have asked me, what can they do to help doctors and staff? Here's what I tell them: get fully vaccinated. And if you're eligible, get boosted. According to a new study, those who get boosted are 90% less likely to die from Delta when compared to folks who only received the initial 2-dose vaccine. Remember, Delta is still the reigning variant. That's the variant that's dominant. And people can end up getting hospitalized and die because of it.
So if infections from Omicron are mild, it wouldn't be so bad then if this variant became the dominant strain, because it seems like Delta is worse. What are your thoughts on that?
So here's what I think, Glenda. Even if Omicron turns out to be a mild variant, it will continue to evolve, right? That's what these viruses do. And then what happens if the virus then evolves to a strain that's deadlier? So to me, the best protection, again, is to vaccinate. And this is to help stop people from getting infected in the first place, and then also prevent severe disease. Again, as we get more information about this Omicron, we'll get it to you right away.
All right, Dr. Nandi, thank you for joining us. Hope you have a good weekend.
You too. Thank you so much.
All right. And if you have a coronavirus question for the good doctor, email him, Dr. Nandi at askdrnandi.com, or you can send it to us on Facebook or Twitter. We'll get it right to him.